What do you do when you've reached your health goal when you're taking a GLP-1 medication? Hi, my name is Dr. Lindsay Ogle, and I'm a board certified obesity medicine physician. And today we're going to talk about just that. This is all general medical information that I want you to pay attention to and learn from, but take back to your own physician and your medical team for an individualized treatment plan that is best for you. None of this is direct medical advice, but I think is wonderful information to have. So what do you do when you've reached your goal with a GLP-1 medication? It really depends why you're taking the medication. GLP-1 medications have actually been in clinical practice for 20 years now for the treatment of type 2 diabetes. The most commonly prescribed GLP-1 medications for type 2 diabetes right now are Ozempic and Mounjaro. And for many people, once they've reached their A1C goal, they're able to titrate down to lower doses of their medication for maintenance. So that's possible. But many people, I would say most people, need to continue on it to continue their blood sugar control long term. And that's okay. We have found over these 20 years of clinical practice and longer in studies that these are safe medications long term, as long as they are working for you and you're tolerating them well. I have a whole video where I talk about the side effects of GLP-1 medications that I will link here so you can take a look at that if you have questions about the side effects specifically. If you are taking a GLP-1 medication for the indication of obesity, which is most of my patients who I'm seeing clinically, they're taking it for that indication. This can vary depending on the duration and the severity of someone's obesity. So like any chronic medical condition, there is a spectrum of disease. I have patients who have struggled with the disease of obesity since early childhood. I have other patients that obesity has been a newer struggle for them. Maybe there was a specific trigger that led to the weight gain. For many women, menopause is a common underlying trigger. Sometimes it is a medication that they had to take or a life change and lifestyle change that occurred. And so they've had a shorter duration of their obesity, of their disease. For patients who have had the longer course, they've had obesity since childhood, it is much more likely that they are going to need the GLP-1 medication long term. Again, that is okay. There is nothing morally wrong about that. You don't get an award for weaning off of your medication. The award is health, for maintaining your health in whatever way that works for you. The GLP-1 medications that are FDA approved for the treatment of obesity right now are Wegovy and Zepbound. So the patients who are taking GLP-1 medications for the indication of obesity, that is what they are taking, Wegovy or Zepbound. For my patients who the weight struggles have been more what I call acute or subacute, where they have been shorter duration, then I anticipate that they are going to need the GLP-1 medication for a shorter duration, where we can use the medication as a tool to help control appetite, to help increase fullness, and to help any underlying insulin resistance if that is occurring. These patients can utilize their GLP-1 medication for a shorter duration. And when I say shorter, this is still on the spectrum of months or maybe even a year or two. These medications, the GLP-1 medications, are not short-term medications. They are not antibiotics. They're not something that you're going to be able to take for a couple of weeks and then stop and have lasting results. There are two relatively new FDA-approved indications for GLP-1 medications. For Wegovy, that indication is prevention of adverse cardiovascular events, so prevention of heart failure, heart attack, arrhythmias like AFib. And then there is Zepbound has been FDA approved for the treatment of obstructive sleep apnea. So if you're taking those medications for those particular indications, to get the lasting benefit of those medications, you're going to need to take it long term. So I do not anticipate that many patients are going to be able to stop those medications if they start them, if you're going to want to have the continued benefits. I will say obstructive sleep apnea may be a little bit more nuanced because weight is a factor that contributes to sleep apnea symptoms. It is not the only factor. And so you do not, not everybody who has obstructive sleep apnea has the disease of obesity, and not everybody that has the disease of obesity has obstructive sleep apnea, but they can co-occur. And if you are using Zepbound to help with both, and you treat your obesity with Zepbound alongside using Zepbound for your obstructive sleep apnea, your obstructive sleep apnea symptoms are going to improve, along with the weight loss, in addition to the utilization of Zepbound for the sleep apnea. And it could be something to talk to your doctor or your sleep medicine specialist about titrating off, but you would definitely want to follow up with a sleep study to make sure that your sleep apnea is truly in remission once you stop the Zepbound. But in general, let's say that you have decided, along with your healthcare professional, that you have reached your health goal while on your GLP-1 and you would like to titrate off. You would like to maybe stop the medication. If that is determined to be the next course of action, I highly recommend working alongside your doctor, ideally a board certified obesity medicine physician. And if you need to find one in your area, I'll include a link to search for one below. But your family medicine doctor, your endocrinologist are also great people to work with who hopefully by now have a lot of experience with utilizing these medications and will help you titrate slowly off the medication. This is a medication that you do not want to stop cold turkey. What I tend to do with my patients who are wanting to stop the medication for whatever reason, whether it is their weight, they reach their weight goal, or cost has become a factor, they no longer have coverage. My typical approach is to, as slow as once a month, go down on their dose and take a stepwise approach down, like we take a stepwise approach up to higher doses. If anywhere along the way we are starting to see that some negative effects develop, if we're having excessive hunger or food noise, or cravings are not controlled, or blood sugar is increasing, or sleep apnea symptoms are not controlled, then we stop that down titration and either stay at that initial dose or that dose where we're at now and look at maybe lifestyle or some other factors if we can tweak anything at that point, or we may have to go back up and on the dose, and that is okay. That is not a failure. What we are looking for is the lowest dose that we can continue for your maintenance now moving forward. And with any chronic disease that we treat in medicine, there are fluctuations in its course. So sometimes things are less controlled and sometimes they're better controlled, and that is okay. And that is why working with somebody who knows you really well, and or they can titrate your treatment plan along with you so you can always feel well. Once we get down to the lowest dose of whichever GLP-1 medication that you're on, so if you're on a version of semaglutide, that would be 0.25 milligrams. If you're on a version of tirzepatide, that would be 2.5 milligrams. And once we get there, an option would be we could stop the medication if that is what was decided by the patient along with the physician. Or you can start then to space out your doses. So it's typically recommended to do your injection every week. But if we are titrating down, we can see how do you do with every 8 days. And then if that's going well, every 9 days, and then 10, 11, all the way up to 14 potentially. I probably would not go longer than that. And we really are looking at side effects at this point. So, when you are taking the GLP-1 medication every 7 days, it's staying in your system consistently. When you start to space it out, and everyone's a little bit different because of their metabolism and how they respond to medication, but you're introducing the opportunity for side effects to develop when you've gone a period of time without the medication. This is why I wait to do the spacing out until we get to the lowest dose, because when you're at the lowest dose, that's also the starting dose. And so that's where we would start with the medication anyways. So if you had no medication in your system, this is the dose we would start with. So it's much safer to, at this point, to then space out your doses. As always, when you're taking a GLP-1 medication, we are going to touch base on your nutrition and your physical activity and your stress levels and your sleep and mental health. And all of these things need to continue to be addressed over time, and they need to continue to be a priority, because they are what, maintaining those factors is what is going to allow you to be in maintenance long term. Maintaining adequate, healthy nutrition, hydration, physical activity, cardiovascular and resistance training, adequate sleep, and stress management and mental health. Those things need to be prioritized for long-term maintenance. And this is why, even if you get off of your medication, it is still advised to check in with your doctor on a regular basis to make sure that all of those factors are well controlled. And we need to know if they're not, so we can address it as soon as possible. And we also need to know how things are going off the medication, because if we're starting to gain weight again, if hunger is not controlled, if blood sugar is starting to go up, if our sleep apnea symptoms are coming back, we need to restart the medication. And then at that point, it's probably best to continue it long term. And that is okay. Again, I really want to highlight that there is no better route, whether you are taking your GLP-1 medication long term, or if you're taking it for a couple of months or a couple of years and then you're titrating off of it. There is no superior path, as long as we're keeping health at the center focus. And please let me know if you have any questions specifically about GLP-1 medications or about the treatment of obesity in general. I would love to answer them. Have a great week, everybody.